Our news is brought to you by Alive.
Believe in best.
Good evening, Bahamas. Coming up in our news tonight. Why the House Speaker says coastal management laws are needed. The state of an historic park not sitting well with the chairman of the Progressive Liberal Party. We have the details. But first, only 1 in every 10 people in the region are fully vaccinated. What the Pan American Health Organization is doing about it. And later we show you how you can get fit for Father's Day. Welcome to our news and thanks for joining us. I'm Georgie Bain. Topping news tonight. House Speaker and former attorney for the Cabbage Beach Vendors Association, Halson Mutri, is calling for the enhancement of coastal zone management laws to ensure that Bahamians are not denied access to beaches across the country. This comes after Cabbage Beach vendors arrived at Paradise Island earlier this week, only to find their belongings had been removed from the beach and that they were barred from accessing the property.
It was clear to me that the Bahamas needs coastal zone management laws. We lack the proper coastal zone management laws that will establish the high water mark, that would also establish access to the beach. I remember when I was studying as a meteorologist in Barbados, there was an incident similar to this where an investor came into Barbados and tried to shut off access to the beach in Barbados.
Mutri says similar legislation should be passed here in the Bahamas.
The Barbadian Parliament passed the Coastal Zone Management Laws of Barbados, which created what they call in Barbados windows to the beach, so that there's every 1,000 feet along the coast, there's an access to the beach. Not like what we have in the Bahamas, where if you go on the Eastern Road or some parts of West Bay Street, the properties are so tightly knitted together that you can go miles before you are able to make a direct access to the beach. In Barbados, every 1,000 feet or so, you have an access to the beach, and that's the way it should be in the Bahamas.
Well, PLP Chairman Fred Mitchell is slamming government for allowing an historic public park to become overgrown to the point of being an eyesore. The Archdeacon William Thompson softball field has been around for decades under different names in the past. The park is used by C.R. Walker and various softball leagues and has been allowed to become completely overgrown.
You can see that the grass is as high as a Georgia pine and the work has come to a complete stop. As usual, the F&M governments have finished the project and then proclaimed a few months ago in a grand opening ceremony that they had done great favors for the people of Over the Hill. The evidence is that their claims are rubbish.
Mitchell says there are other projects that are behind or have stopped. He claims that it's due to a lack of funding and the government isn't being transparent about it. Works Minister Desmond Bannister responded to Mitchell's claims, saying that the government will not be distracted from the opposition's poor performance in the budget debate and its failure to apologize. As it relates to the softball field, Mitchell describes it as having historic roots dating back to the 40s. He says teams were expecting to have access to it by now.
My understanding is softball should have already started. So the idea was when this park, the whole park was refurbished, and you remember they had a big grand opening saying they had finished that part of the park and were moving on to this part of the park, and now the project has come to a full stop. And that's what you see here with the trees, the grass, everything grown up. It just smacks of inattention.
Well, the Pan American Health Organization is urging G7 nations to prioritize Latin America and the Caribbean. This as the G7 nations pledge to donate 1 billion vaccine doses to countries in need. Only 1 in 10 people in Latin America and the Caribbean have been fully vaccinated against COVID-19.
Yet, we are a region of more than 600 million people where cases are mounting, hospitals are full, and variants are rapidly circulating. So while vaccines are needed everywhere, we hope that the G7 nations will prioritize doses for countries at greatest risk, especially those in Latin America that have not yet had access to enough vaccines to even protect the most vulnerable.
Reporting on the pandemic's deadly trajectory, the PAHO director says more than 1.1 new COVID-19 cases and 31,000 deaths were reported in the past week in the region, including the United States and Canada. Over the past few weeks, 4 of the 5 countries with the highest weekly death count in the world have been the Americas.
I want to be clear that the primary issue in the Americas is vaccine access and not vaccine acceptance. Across Latin America and the Caribbean, we have a long legacy in immunization and trust in the life-saving power of vaccines. Once new doses are available, countries are ready to distribute them as quickly as they arrive. And PAHO will work tirelessly to get vaccines to every corner in our region until this pandemic is behind us.
Edian says as vaccines arrive in the region, they should go first to populations at high risk of developing severe COVID-19 cases, such as the elderly, frontline healthcare workers, and people with pre-existing conditions.
Health workers should receive special attention as they're not just at greater risk of contracting the virus, but they are also some of the most trusted voices for vaccines. People naturally turn to health workers, including doctors, nurses, and community health workers for medical advice. So we must ensure that our health workers have the information that they need to answer their communities and their own families' questions.
Millions of people around the world are celebrating World Sickle Cell Day today. The special day means a whole lot to those who have been diagnosed with the disorder, like this high schooler in this next report. Our Jasmine Brown heard her inspiring story.
16-year-old Karish Mitchell is a 10th grade student at Queens College. She was diagnosed with sickle cell at a very young age.
I was crying all the time and my limbs would get swollen. They took me to the doctor and I was having a lot of fevers, and they ran a few tests, but they did not know what was wrong. So the doctor had asked both my parents, do any of you guys know if you have the sickle cell trait? And so my dad was like, I have it. And my mom was shocked because she didn't know she had it either. So she was like, what? I have it too. And so that's how they found out. And I was diagnosed with HBSS at 15 months old.
Sickle cell anemia is a disease where red blood cells break down or shape into slimmer, tinier cells than normal, which can cause a shortage of healthy blood cells to help the immune system. Symptoms vary to include the blockage of blood cells, pain, fatigue, and can last several years or be permanent. While sickle cell is a rare condition, it is also a serious one because if not treated, it can lead to strokes, seizures, loss of consciousness, and much more. At only 16, Mitchell already knows what it means to lose a loved one to sickle cell after her aunt died in 2019.
Cindy Wright, she died, and she was very close to me, and she helped me through all of this.
Like others out in the world who go through this disease, Mitchell fights every day with sickle cell.
My journey has been very overwhelming, I guess, because even as a child, when I used to go to my old primary school, a lot of kids, they would not understand my condition, and I was just unable to do a lot of things in PE, and I would just try to fit in so that I wouldn't get called weak or lazy, and it would just be really hard for me. I also suffer with asthma, so every time I go to the hospital, it's a challenge with my oxygen. So there would be many times I would get an asthma attack during PE, and it would eventually lead to a crisis.
Mitchell says she has spent many days in hospital, including on her birthday, the day of her aunt's funeral, and during the height of the COVID-19 pandemic.
I was admitted when COVID first started to strike, so they had stopped visiting hours. I would just say being in that position was very lonesome and very isolating. It felt like no one was there for you, and you had to communicate with all of your support via technology. And I would just cry myself to sleep in the hospital, even through all of that pain. Beside the pain, I was also going through emotional pain because I couldn't have anybody to be there with me.
Despite the challenges, the 10th grader says she has gotten through the toughest of times with the help of her faith, family, and fellow sickle cell warriors and members of the Bahamas Sickle Cell Association.
So I decided to take action, and that's when I came up with the idea to get pins, to sell pins and, purchase pins. And I was so glad when the shirts came out, and there are new shirts now too. So I'm so happy about that. I'm trying to do as much as I can. I don't want a lot of people to go through this. It's important to get tested to see if you have the gene in your blood.
Reporting for R News, I'm Jasmine Brown.
Well, still to come on R News, a local foundation is making it a little bit easier for you to donate blood, and an artist over on Grand Bahama is working to inspire those through his work. That's coming up when R News returns. You're watching R News. Welcome back. If you missed this week's National Blood Drive, it's not too late for you to still give a gift that could save a life. If you've been apprehensive about visiting a blood bank to make a donation, Chairman of the Friends of the Blood Bank Foundation, Basil Christie, says his group is willing to meet you and a few of your closest friends just about anywhere you feel comfortable.
People don't like going to the Princess Margaret Hospital Blood Bank because you can't find no parking and it isn't even accessible. So what the Friends of the Blood Bank Foundation does, we go to all the different clubs, service clubs, fraternities, Masons and whatnot, and offices in the Bahamas, and organize blood drives in their offices and in their clubhouse and in their kitchen or the lobby or the foyer or wherever.
Hospital Administrator Mary Walker making this plea on behalf of the blood bank as she rolled up her sleeves to make her regular donation.
We need blood because there are things that are happening all the time in the community. You have the acts of violence, although you do have persons who require blood for particular ailments. We have cancer patients who need it, dialysis patients who require it, and of course there are persons who suffer from chronic anemia. And so if we can get persons just to think about others and to continue to donate blood, or even if you've never done it, come on out and do it. It's nothing to be afraid of, and we know that when you give blood, you save a life.
For those who have a needle or blood phobia, Walker says there is nothing to fear.
You come in, you do your interview, they go through the questions just to make sure that you're not donating out of turn, because we know it's a set period in between donations. You're actually stuck in the arm with a needle. You do feel it going in. It's like a mosquito bite, and then thereafter, it's just fine.
There's nothing to be afraid of.
Nothing to be afraid of. At the end of the day, you get the drink of your choice, whether it's Vitamalt or Guinness. So that's it. And then you go home and you rest for a while, and you're great. And
Christie has been a regular donor for more than 20 years. He explains the benefits of donating the precious gift.
So this is an appeal to the public offices. Last year, office opened, every office closed last year. But going forward, if you want, not if you want, I want you to contact the blood bank, and we'll organize a blood drive in your office with your staff. See, some of your staff, get 100 staff members. Out of them 100, we only want about 25 or 30 people to give blood. Because the blood, the life you save might be mine.
The Ministry of Health's National HIV and AIDS program is hosting free testing on Fridays for the month of June at Armbili Park. The initiative is free for all and encouraging persons to know their status. We caught up with a few people who turned up to get tested.
You need to know your status. If they offer free care, you can live a long time with HIV and still have a healthy life, but you need to catch it early.
Something good to have knowledge of, and so you don't pass it on to anyone else. We're a small nation, so we already have a high population, so anything that could be done to help reduce that number, I'm okay with that.
When our news comes back from the break, Father's Day is just a few hours away, but we still have one more gift idea that you may want to consider for dear old dad. That and much more when our news returns. By now, Father's Day menus may already be planned, but have you thought about treating dad to a future of fitness? Our Christina Dragovich takes a look at a unique gift for a special dad in time for Father's Day.
For some people, it's going out and, grabbing some drinks on a Friday evening, at 5 p.m. But here it's, our happy hour starts from 5 a.m.
Happy Hour CrossFit has a mission to engage and motivate people on their fitness journey. Head coach and owner Jaime Thompson says that means helping people to take the first step into a brand new life.
What you do today is what's going to affect you tomorrow. We focus on sculpting your functionalities to its optimum potential so that we can help you live a fitter, healthier, and happier life.
It's not your typical gym, free from mirrors, machines, and even AC, but it's big on impact. The pandemic has been tough on gyms and on parents. Thompson says Happy Hour CrossFit is doing something special for dads this month.
We want to provide those dads, those husbands, with an opportunity or an outlet that'll provide them with the opportunity to, not just focus on the stability component of life, but also their personal fitness.
Are there any workouts that people can do at home if they aren't able to make it to the gym? What can people do?
Actually, yes. So I'm going to take you guys through a at-home workout. So it's going to be core specific. So we've got an at-home core workout for those who aren't able to make it out to the gyms yet. They're not ready to, get themselves a bit more out into the community or back into the gyms. It's what we call the Tabata style workout. So it's very common. So it's 8 rounds, or I'd say 8 intervals, 20 seconds of work, 10 seconds rest. If you guys would like, you can take out your pen and paper, write this down, and knock it out when you can. So movement number 1 is going to be an elbow plank. So we're going to be going down into the top of a plank position, holding for 20, so we'll rest for 10. We're going to flip over for movement number 2, which is going to be Russian twists.
So we went on to Supermans and finally sit-ups.
Ready? I think so. All right, let's go.
It's not too bad. Pretty easy to do at home with no equipment, just a timer, I guess.
Yeah, just a timer and a floor. You get to it.
You can still have your crab and rice and eat it too. The special at Happy Hour CrossFit runs until June 25th. Reporting for our news, I'm Christina Dragovich.
Can art inspire change? That's a question one artist is seeking to answer. In this edition of Grand Bahama in Focus, our Jillian Gray speaks with a woodcarver creating some daring pieces aiming to inspire his community.
These are fathers and sons, I call them Bahama Papas, and then their sons.
These 5 faces shooting out of this living tree is the brainchild of woodcarver Brian Maycock. The Grand Bahama-based woodcarver has made dozens of sculptures for the Central Grand Bahama Community Park, and this one, he says, was designed to inspire and celebrate fatherhood.
Portraying the men of our nation.
What it is that you want to see.
Yes.
Wow.
Father and son, and I've seen fathers and son come up here and enjoy the park, as well as fathers and daughters, and that's something that very encouraging to see that, the community is built on a strong family.
Maycock has been a wood carver for more than 35 years, getting his first start by observing wood carvers in his community. Though some may only see fallen trees, Maycock says the sculptures are often outlined in his mind's eye the moment he lays eyes on the raw material.
And the minister was looking at it and he said, what you think you want to create right here? It was just a stem coming out. And I say, well, I've seen a lot of the lizards, all sorts of different lizards around. So I struck a piece with two curly-tailed lizards right here, you know, and it would actually be like a sitting piece for anyone who would come and want to sit down and take a picture.
From Bahama parrots to turtles, words like courage and strength, Maycock has filled the park with vibrant pieces he hopes will uplift the community. And while the sculptures may look complicated, Maycock says some are designed in less than a day.
It don't take me very long because once you know what you're doing, you can really cut it out real fast. These pieces here, I could estimate about roughly 5 hours. These are real simple.
I thought you were going to say like 5 weeks or something.
No, I did these pieces within a couple of days. You know, just roughing out the detailed work is meaning the length of time. You know.
Maycock says it's when he sees families enjoying the artwork in the park that he's most fulfilled. Reporting for Our News Weekend, I'm Jillian Gray.
Well, still to come, the Lyford Key International School is celebrating a new milestone. The details after this break.
Every new season of On the Record, we push the limits. Venture into unknown territory. We take our cameras into places unseen before. We share the stories and experiences that affect us all. And now it's time for Season 5. On the Record, Thursdays at 8 p.m. on RTV Cable Channel 212 and streaming live on Facebook on the Our News Bahamas page.
Lyford Key International School marking a major milestone last week, cutting the ribbon for the official opening of the school's upper school campus. The building is a part of Phase 1 of the Upper School project. The tract of land was purchased in 2014, the first step in what has become the most significant development in recent history for LCIS. Outgoing chairman of LCIS Board of Directors Brian Clinton says the new facilities will enable LCIS to expand and enhance its programming in many areas.
Because we're in COVID, having this new upper campus allowed us to bring all our kids back face-to-face while complying with the COVID-19 regulations. So that was very important for us. Secondly, it will allow us to increase programming. You saw some of the science labs that we have here and the technology in that lab, which I think will further enhance what's available for our students and really bring out our curriculum. So I think it's that, and this is really just laying the foundation of what's to come. We definitely view the school as being a community hub that will attract performing arts and the like, and really opening up our campus to the community.
Prime Minister Dr. Hubert Minnis, Deputy Prime Minister Desmond Bannister, and Education Minister Jeff Lloyd got a tour of the site. The 35,000 square foot Gateway building will house 350 students from 6th through 12th grade. The facility is also the first completed step and will be intended to be a centerpiece of the 17-acre upper school campus that is currently underway and under development. The Gateway building features facilities for science, technology, engineering, arts, and mathematics instructions like teaching labs, music recital spaces, and art studios.
We have been able to operate face-to-face really since November. At times we were not at full capacity, so students had to take turns coming to the campus. But the moment that this upper campus has been opened, everyone could come back to face-to-face. The secondary school students, because they have different teachers, it's a little more problematic, but for the most part, we're really pleased and feel fortunate to live in the Bahamas. It's been an excellent location to ride this pandemic out.
The new campus is also getting high marks from students.
I think opening the new campus, especially in a time of COVID and, very serious times, I think this is a very tremendous opportunity, and it gives us an opportunity to actually experience the learning style in a different way, because instead of being home, we're actually able to come on campus and interact with our peers, and it feels like COVID doesn't really exist, minus the fact that we still have to wear our masks at school and follow all protocols. I do appreciate the new campus because the facilities are amazing. Like my favorite room right now, I'm not a music student, but my favorite room is the music room. There's a sense of peace in there, like it's very tranquil, like it's just amazing.
Well, thank you for joining us for our news tonight. On behalf of the entire team, I'm Georgie O'Bain, and we'll see you right back here tomorrow night. Have a beautiful evening, Bahamas.